Welcome to the Vibrant Clinician training video. In this session, we'll review how Vibrant works, the clinical data, and the process for prescribing it. You probably see a lot of patients struggling with constipation. Research shows 59% of them are dissatisfied with their current treatment, and 78% of prescribers are frustrated, feeling like they have nothing new to offer. That's where Vibrant comes in. Vibrant has three main components. The first is a drug-free disposable capsule, which is expelled naturally during a regular bowel movement. The treatment involves taking one capsule daily before bedtime, 5 days a week. Each capsule must be activated before swallowing using the second component, the pod. The pod transmits the treatment protocol to the capsule during activation. When connected to electricity, the pod's light ring turns solid blue, indicating it's ready. Patients should keep the pod powered at all times. When a capsule is placed in the pod, the light ring turns green after a few seconds, signaling that the capsule is ready to be swallowed immediately with a glass of water. Each activation is logged in our HIPAA-compliant cloud, providing data to help you make informed treatment decisions. While the pod and capsules are sufficient for clinical efficacy, the third component, the optional but highly recommended Vibrant Companion app, enhances the patient's treatment experience. The app features an e-diary for patients to track and monitor their progress, requiring only 30 seconds to fill out. Patients can also generate a report of the past 12 weeks of e-diary data and capsule activations. This report can be shared with you to provide insight into their treatment adherence and progress. Additionally, the app offers reminders, tips, and helpful content. We strongly encourage patients to download and use it. After being swallowed, the capsule travels through the digestive system. The next day, once it reaches the colon, it begins working. Vibrant's drug-free approach uses gentle vibrations to mechanically stimulate the colon, promoting contractions to propel its contents. For patients with chronic idiopathic constipation, CIC, the colon's biological clock may be altered. Vibrant's time stimulation aligns with these alterations, helping the colon contract in sync with its biological rhythms. Vibrant is indicated for adults with chronic idiopathic constipation, CIC, who have not found relief from laxatives taken at recommended dosages for at least 1 month. Suggested patient profiles include patients who failed to secrete a GOG treatments and need symptom relief without diarrhea. Patients in high-stakes professions, for example, operating room nurses who need predictable bowel movements. Patients seeking a drug-free approach or taking multiple medications, minimizing side effects and interactions. Our Phase 3 clinical trial, published in the Gastroenterology Journal, demonstrated that Vibrant significantly improves complete spontaneous bowel movements, CSBMs, and related symptoms in patients with chronic idiopathic constipation. The trial's primary endpoints showed that 39.26% of patients experienced at least one additional weekly CSBM over their baseline, while 22.7% had 2 additional CSBMs per week. Vibrant is safe, well-tolerated, and provides predictable, drug-free symptom relief with minimal side effects. Mild gastrointestinal adverse events were similar between the Vibrant and placebo groups. A small number of patients reported mild diarrhea or a vibrating sensation, but no patients withdrew due to side effects. The Vibrant capsule is not safe for magnetic resonance environments. Before performing an MRI, ensure via X-ray that all capsules have been expelled. Multiple capsules in transit through the digestive system are normal. The device hasn't been tested on patients with implants such as pacemakers or nerve stimulators, so prescribing in these cases is at your discretion. Vibrant is contraindicated for anyone with a history of complicated or obstructive diverticular disease, those with a known or suspected intestinal or colonic obstruction, patients showing signs of significant gastroparesis, anyone with a history of serious gastrointestinal disorders, including inflammatory bowel disease or gastrointestinal cancers. Celiac disease is okay if it's been treated and is in remission. Patients with anal fissures or fistulas, those with Zenker's diverticulum, trouble swallowing, esophageal stricture, eosinophilic esophagitis, or achalasia, and patients who are pregnant or breastfeeding. In a recent study, Vibrant was compared to lanaglutide for CIC management and showed significant improvements in quality of life, including significantly fewer side effects that most often contribute to treatment discontinuation. Vibrant must be prescribed to Eversana, our designated specialty pharmacy, shown on the How to Prescribe section of our website. Please note that prescriptions sent to other pharmacies will not be processed. Eversana handles benefits verification, prior authorizations, and delivers Vibrant directly to the patient within 5 business days. Be sure to choose Eversana when you send the prescription in. To prescribe Vibrant, select it in your EHR like any other medication. 2 codes are available. One for the starter kit with the activation pod and 20 capsules, and another for refills. Include the patient's ICD-10 diagnosis codes and details of prior CIC treatments in the prescription notes. For new patients, it's recommended to prescribe both codes, since treatment should continue for at least 8 weeks before assessing its effectiveness. Patients can pay monthly rather than upfront. Tips for optimizing treatment. Encourage adherence to the 5 capsules per week dosage. Set realistic expectations. Some patients see results within a week, while others may take longer. Evaluate efficacy after 8 weeks. Recommend swallowing the capsule between 9 and 10 p.m. or just before bedtime. Placing the pod on the nightstand serves as a helpful reminder. Urge patients to download and use the app for tracking and reminders. Thank you for completing the Vibrant training. For questions, please visit our website or contact us via email. We're here to help.